So for the knee, after we've done all the testing, I like to get in here with the different tools. If it's like right over the joint line, I'll use the flathead. If it's right where the MCL is, we'll use this because there's not a lot of tissue there. If it's more up here in the muscle, I like to use this one and get in there and kind of work on the muscles that may be tight around the area. And we'll use this to release it. We'll also check the thigh muscle. We can get up in here and we can, find any kind of what I call speed bumps and use the percussor tool to work those over as well too. Now what I also like to do is, let me get you to flip over. Maybe you want to pause it for a second. Don't like to get in the popliteal fossa too, so we get in here. This is particularly good with patients with knee surgery. We'll get in here and work this over and loosen up any areas of adhesions. And then we'll also work down into the calf, finding any area that's tight and work that down at the same time. You can also check to see with the knee, I also like to look at what's going on with the iliotibial band. So we can also go from here down at the same time, and we can get in here and work this down, coming all the way down the length of the muscle down into here. Obviously I will hold it for a longer period of time to try to work that over. So we'll work on those areas. Particularly, this is where this white head can come in handy because this can slide over the clothing. So we can really get in there and slide and strip that down at the same time, kind of moving up and down to work that over. If they've got a hamstring strain, we can get in the same way to kind of work over wherever you feel that muscle is tight. When they have it as a really, really small, deep one, that's when I'll get in there with a little pointed attachment. This one here. And we can work very, very specifically and nice and deep in there. So we can get in there, find that area where it's tight, get in there with that pointed one, and get down to some deeper types of muscle spots there. Nice and easy. Okay, go ahead and stop that.